Hello, you're watching my YouTube channel. I'm your host, Kamran Arshad. Today, I have invited a guest to my vlog, and I'm going to discuss her life, her visions, her goals, and most importantly, her field. Hi, and welcome. We are delighted to have Ayman Ahmed here today with us. Ayman, thank you so much for joining us today.
Thank you so much for inviting me over, and I would love to share my expertise and my knowledge with everyone who would be listening.
Mhm. All right, but before to start this interview properly, Ayman, could you please tell us what inspired you to pursue a career as clinical psychologist, health and wellness coach, certified fitness trainer, and perhaps share a bit about your journey leading up to your current role?
Yeah, basically, that was my personal preference in everything, in every domain, actually. I started my career from clinical psychology. So I did master's in clinical psychology, and sidewise, I started training as a physical trainer in the gym. I used to work out as a client firstly, and then I got motivated. I saw how people are struggling with the mental stress while they are doing exercises or working out, and how they're facing issues while the whole process is going on. So I thought of having a certification as a health and wellness coach as well. So that made me do this degree actually.
I wanted to know the person about that who helped you or who tell you that you are actually made for this. I have
Well,
another
I had
question. If I
different.
interlink this with this question, when did you find yourself that Ayman Ahmed is made for this?
While I was very young, so I used
Was
to
still
ask
young.
my mother that, sorry?
Was still young.
Yeah, but when I was in my childhood, actually. So I used to ask my mother that I really like reading people's mind. So my mother used to tell me that you should pursue your career in clinical psychology then. So first I used to hesitate, but later on I never knew that I am going to end up in this field. So that was, I think, the main. My mother was my main mentor in that thing. And secondly, talking about my fitness journey or as a physical health coach, that was different trainers in my gym used to encourage me that this is one of the elements, especially within Pakistan, that people are not taking this important, that how emotional or mental health is equally important as physical health.
Mm.
So that is why I chose this career, and I thought that this is something that we can really work on, and we can make people aware about this thing, that how emotional and physical health work in an equilibrium.
If you're talking about the choosing a career, as you told me, so it is very difficult task for a person who are able to choose any career, right? But most of the time, people who graduated from the university, so they don't know what to choose for their future. So, did you face any kind of difficulty when you were at that stage choosing a career?
Uh, yeah, basically, I was when I did my bachelor's in psychology, I was really confused that either should I pursue my career, my specialization actually in clinical psychology, in child psychology, or should I switch to something else? Like we have an option of doing speech therapy as well. But later on, while I was doing my internships during my bachelor's time, I noticed that a lot of people are facing mental issues, and everybody is quite stressed out nowadays. So this is a very common thing, and I think it needs to be addressed more and more over time. And people are usually facing, like in their everyday life, they are facing a lot of issues. So I thought that I can contribute my expertise and my knowledge and my experience and my qualities as a clinical psychologist. So that is why I was quite clear in what I have to choose in my career for the future.
Fair enough, Eamon. Could you please share a little bit about this? What is the difference between the psychology or a clinical psychology? Because
Okay, psychology is a very
people are not aware of this because there is a lot of confusion circulating in the society. If I am suffering from a mental health, so someone comes to me and tell me that you need to go to the psychologist, you need to go to the psychiatrist, you need to go to the clinical psychologist. So there are a lot of perceptions in a society and circulating that. So could you please tell us what is the main difference and how did you diagnose a person and refer to him or her to the clinical psychology? Is the patient of clinical psychologist? Is a patient of psychologist or psychiatrist or or a simply psychologist?
Okay. Basically, I will start from mental health. Okay. So basically, the thing is that if someone is facing a mental stress or an issue, so we end up seeking either a psychologist or a psychiatrist who are dealing with mental issues or mental stress. So what the main difference is between a psychologist and a psychiatrist is that a psychologist basically performs therapies and they guide people through counseling and different techniques which are adaptations in their life. So we what we do is we try to find the root cause in the issue or in the person, what the issue is, and then we direct the person through the therapies and treatments towards their desired goal. And this is a long term run. In the long term run, while a psychiatrist is a MBBS doctor who has done his or her specialization in psychiatry, and their main goal is to prescribe medications. So basically, their treatment is through medications, and our treatment is through therapies.
Mm, this
So
is
this is the main difference between a psychologist and a psychiatrist. Other than that, what is the main difference between a psychologist and a clinical psychologist is that a psychology is a very vast field, and we had different domains. That there are multiple domains or specializations that can be pursued in the future. So these specializations could be either a person with a psychology background can either go to a clinical psychology, educational psychology, child psychology, forensic psychology, or there are many fields that are either counseling as well. So what we can do is that it's our priority. What we see what's our priority, and we lead the person towards their career they want. Okay, basically a clinical psychologist is the one who pursue their career and they assess and they treats the person who are facing psychological disturbances like depression, anxiety, or other stresses. While a counselor, maybe they can guide a person in through their vocational training or through their whatever the life changes they need, like career counseling, academic counseling, marital counseling. So the counselors can direct a person towards that thing. Whereas a clinical psychologist, we what we do is we work on the physical needs of a person accordingly whatever mental issues they are facing.
hmm. And what is the age bracket of the patient?
Well, age bracket, basically,
Because
there's no
everyone is
age
suffering
bracket
from
actually.
anxiety, everyone is suffering from depression in the society nowadays. Even though if they are actually studying in a college or a university, they have a burden of education. If they are getting a job and they are looking for an opportunity, they have a depression because they are mentally or physically fitness definitely it affects, right? So, could you
Yes.
please share your opinion about what age bracket did you cater that so far?
Well, I believe that when we talk about psychological issues or psychological problems people are facing, so there is no age bracket because whenever we see overall throughout the world actually, so there are multiple issues being faced
Hmm.
psychologically. Starting from a very early age, children are diagnosed with autism, ADHD, learning disabilities, or other kind of issues. While when talking about depression or anxiety, the age bracket I can say is starting from 18 years, or either we can also say that they are starting from 14 years nowadays.
14.
Because with time, yeah, 14 years, because people nowadays are sorry.
Then it's an alarming situation for us.
Yeah, even I have worked as a clinical psychologist in a drug rehab as well for 1.5 years. So I used to see clients coming from the age bracket of 14, 13 years old who are exposed to these things through their peers or through their family members, and they're indulged in these things. So I cannot define a specific age bracket for this issue.
All right, let's move on. How do you integrate your expertise as a clinical psychologist with your roles as a health and wellness coach and fitness trainer to support your clients' overall well-being?
Okay, so basically, I approach my clients in a holistic standpoint. That means that physical and mental health both work together and equally. As a psychologist, I understand that emotional and cognitive aspects are affecting our fitness training as well. So, combining that with the fitness training, I help them build both their physical strength and mental resilience, ensuring that they feel emotionally stable and they work on their fitness goals.
Hmm. All right, that's great. And in your, if I talk about experience, what is the relationship between physical fitness and mental health, and how do you help clients leverage this connection?
Okay, I believe that there is a very, very strong relationship between physical fitness and mental health. Specifically, when we do exercise, not in terms of working out in a gym, but even walking or doing any other physical activities, we release endorphins, dopamine, serotonin, which naturally boosts up our mood and reduces stress. I actually help my clients to recognize that working out is not only about physical fitness, but also it directs us to the mental clarity, reducing anxiety, and managing depression. By framing fitness as a mental health tool, clients are often more motivated and stuck to their routine in the long run. Also, I like to add that there is a term called as sublimation in psychology. Basically, that is our defense mechanism, which means that we channel our unwanted impulses into something that is less harmful or more helpful. Like,
Hmm.
for example, if someone is struggling with anger issues, so we can help them and we can guide them to do more physical activities like boxing or whatever they are like. So that way, instead of
They
displacing it to someone else, they
try
can
to
displace it to something more beneficial.
try to use his anger on any activity like boxing, wrestling, or any game. You
Yes.
indulge him to any game, so he can definitely make his aggression as productive, and he can be a best player
Yeah.
in coming days.
Hmm.
I have an anger issue as well, so what should I do? I'm uh, I'm
So maybe you can consult me.
then I have to pay you, right?
We can talk about it later on.
All right. Let's. What common challenges do you encounter when working with clients on their health and wellness goals, and how do you address these issues?
One of the major and most common issue or challenge that clients face is emotional roadblock. That means that clients usually suffer from stress, lack of confidence, or emotional eating that interfere with their fitness goals.
You
So,
know,
as a psychologist,
I would like to interrupt you at this point because it's a new thing for me. You were saying if you are actually saying that if he has an anger issue, right, and a lack of confidence. So lack of confidence is a mental issue.
no, it's not an issue, but obviously, a person feels down or hesitated while talking to other people. So obviously, we can relate it and say it as a mental distress. That if maybe might be that a person has low self-esteem, that is why he has low self-confidence, or maybe he has been bullied in the childhood. That is why he is not able to confidently convey or speak in public.
And then how do you deal with them, like counseling for boost up their confidence? Counseling is
Yeah,
a
as a psychologist, I'm able to work through these mental barriers within them. That, for example,
I'm
we
also the
introduce
same issue.
system.
That's why I'm interrupting you. Sorry, because it's a
Okay, no,
podcast,
it's okay.
so I have right to ask the right question at the right time.
Yeah, sure. So basically, what we do is that we introduce some strategies. Like there is a therapy called as, or technique called as cognitive behavior therapy, or CBT in psychology. So we try working on them, that like we change the cognitions of the clients, like thinking of the client, and then we see how the behavior is changed accordingly. Also, people who are stressful or who are anxious can be introduced with something like mindful exercises or deep breathing or yoga, which can help them bring positive change within them. Or and also I help them overcome these challenges by reinforcing them positive self-talk and helping them making more accountable changes, like something like more manageable goals. What we do is like we introduce some long-term goals or long-term results, whatever they want, and then we can tailor them into short-term manageable goals that are more achievable for the client. The
Hmm.
client is actually reinforced by the short-term goals they achieve.
Hmm. Eamon, you have been working as a clinical psychologist, right? So definitely you have to deal with clients, you have to deal with patients on a regular basis. So how do you manage your mental stress?
Uh, I usually manage my mental stress through working out in the gym,
Is it a good
and
question?
either
Is it
no,
really good?
obviously that's a very good question. And I would also like to add that while I was studying in my bachelor's, so my teacher used to tell that every after every fifth patient, a psychologist himself or herself should also seek another psychologist and talk about things, because obviously when we talk to another person or people with mental stress or negative thinking, so we take out their negative thinking, and sometimes some psychologists they take the negative thinking, or they just absorb that within themselves. So to rule them out or to sublime them, I actually use sublimation in my life, that I reduce my stress or reduce all these things by working out in the gym.
That's really great. And what do you do for fun to find time for you?
Sorry?
What do you do for fun?
Fun? Well, I love hiking, I love swimming, I love working out in the gym, and I love music, long drives. I love watching movies. So this is it. And also, I love baking and cooking as well.
This is really a good thing. I've come to know that you know how to swim as well.
Yeah.
And where was I? So I'm just thinking about myself that I have done nothing in my life just to speak.
Mm. No, I think you have achieved a lot. That is why you're sitting here interviewing another person, right?
I'm taking it positive because I am speaking with a clinical psychologist. Otherwise, if I do not
Yeah,
agree
you
with you,
should say
you will
that you're a
charge me a
positive
fee.
person.
Then you will charge me a fee. All right. All right. How do you tailor your coaching and training programs to meet the unique needs and goals of each individual client?
Well, every client has different needs. So I begin by assessing their physical capabilities, mental health status, and personal goals. For example, if someone is struggling with anxiety, I may include some calming exercises within their routine, like yoga, deep breathing, PMR, which is known as progressive muscle relaxation, alongside with their strength building program. This way, the plan is truly personalized and addresses both their mental and physical health as well. Also, people are more encouraged to make flexible, realistic goals within their lifestyle, so
Hmm.
that they are achievable and more attainable with time.
And what strategies do you recommend for clients to maintaining long-term health and wellness changes rather than restoring to quick fixes?
Well, the main thing or the key strategy I would like to tell is that encourage my clients to focus on their lifestyle and change their lifestyle rather than going to temporary fixes. The main idea is to shift their mindset from quick results to lifelong wellness. I encourage my clients to develop habits that can be maintained over time, like they pre-plan their meals. They do regular exercise, and exercise does not mean that working out in the gym. It can be anything they like or anything they want or any activity they like. Like if they like hiking, they like swimming, they like boxing, or they like going for a walk. So they could manage it within their life, and also stress management techniques should be incorporated within their life to bring long-lasting changes.
Mm. Eamon, we are living in the era of digitalization, right? And we have been using social media for a lot of purposes. Someone using social media for propaganda, someone using social media for fun and entertainment, and someone are using social media to approach the people, engage them with any productive activity. So don't you feel social media is affecting us, and it is actually the main cause for the mental issues?
Well, I think that like you categorize different people, different set of people, that people are using social media for different purposes. Obviously, if someone is using for something like games or they are overusing it, obviously they would negatively affect them. But if they are using social media for something like beneficial or for finding or searching jobs or new opportunities or encouraging people or influencing people,
I
obviously they would not affect them that
needed to
way.
engage the people because people who do not have access directly to you, they will watch this interview, they will listen this interview, they can apply these strategies you have shared to me, so they can make their life very healthy in coming days, right? So I use social media just for the productive purpose. But I'm sorry to say, I'm not claiming that I'm the very good man and I did nothing wrong in my life. But the thing is, we have to analyze about our life, about our mental health, which actually disturbs us. Over to you, man.
Yeah, I think you're right. And secondly, what I feel that sometimes personally, I would like to share this as well, that I feel very overwhelmed while using Instagram, or I keep on using Snapchat. So yesterday I was feeling the same thing, that I am overusing social media. So what I did is that I removed those apps from my screen, so that whenever I open my mobile phone, I do not unconsciously open those apps and waste my time over those. So
That is,
I think everybody should manage their time accordingly and do not waste their time by overusing social media. That could affect their life mental health.
we should use everything as productive as we can, and excess of everything is bad. We need to remember these things,
Yeah,
right?
right.
Okay. Can you share a success story that illustrates the positive impact of your integrated approach on a client's mental and physical health?
One of the major issues I feel that people are facing is stress nowadays. So I would relate it to this that one of my clients was struggling with chronic stress and weight gain.
Hmm.
So what we did is, and they never wanted to join gym or they never wanted to work out. So what we did is we incorporated mindful techniques first, like stress relieving exercises, and we encouraged them to do walk in their house only, okay, and then we encourage them to do to go out and then start doing walk. So what they did is they felt a balance in their life. Over time, they also started facing steady progress in their physical health, along with their emotional control. They shared how the integrated approach not only improved their fitness, but also gave them mental resilience and peace and the confidence to maintain their healthier habits in the long run. So, timely, what the person did is that they started doing walk in their home. and then they changed their setting to the park, and then they shared it with me that they like swimming. So what I did is I encouraged that client to go for swimming because it's summers. So what they had this ideal time to do swimming. So they felt change not only in their physical strength or resilience, but in their mental clarity as well.
That's great. Eamon, thank you so much for joining us today. It was wonderful having you here and learning from your experiences. But before I wrap up, is there anything you'd like to share with our audience or any message you'd like to leave them with?
Okay, sure. And by the way, thank you so much for inviting me over once again. And what would I like to advise people? I would like to advise as a clinical psychologist and as a health and wellness coach is that we all should help each other grow. And we should also, whenever, since stress is a part of life, so what should we do is that being human beings, firstly, we should help others. Secondly, what should we do is see whenever we try to solve a problem or whenever stress comes in our life, we should focus on being problem focused rather than emotional focused. Obviously, grief and being emotional is a part of life for everybody, despite the gender. But what should we do is we should encourage each other, and we should seek guidance from others. And secondly, whenever we try to solve a problem, we should be problem focused by managing it through firstly introducing a long term goal or whatever result we want, and then we should divide it into short term goals that are manageable, and then when once they're achieved, we will be reinforced and we will be self encouraged, and we would be positive that we can achieve the desired result as well.
What a
So
positive
I think this is it.
What a lovely piece of advice you have given to us. People will watch this interview and they need to make this advice in their heart, in that place where they have a lot of things, right?
Yeah, and I think we should be positive no matter what. I know that this is life and everybody's life is hard. But what should we do is that we can stay positive and we can show patience in a lot of things and in every domain of life. Either we are struggling with job issues, financial issues, relationship issues, or any issues. So what health issues. So what should we do is that we should try our best to work on them, and we should try being patient and show resilience in our life.
We should remain calm
And
and
that is the only thing that keep us going.
we should remain calm and cool, be positive, and spread the positivity for the society, for the people of Pakistan, for the people of the world as well. Eamon, any
Yes.
message or any suggestion for me?
For you, since you told me that you are struggling from anger issues, so I would like to advise you something regarding that.
All right.
So
No,
maybe, yeah, maybe when we talk about anger issues or anger management, what generally we can do is like, firstly, we should know that either we are having anger issues due to a particular aspect, or we are generally feeling anger in everything. If we are generally feel frustrated, or we show anger in little things, so what should we do is we try to keep quiet mostly rather than displacing it onto someone else, or we should leave the room or distract ourselves whenever we feel angry.
Even thank you so much for the advice specific for me. I'll definitely apply these strategies in my life and will let you know that
Good luck.
how much I have changed myself so far. Thank you so much for
Yeah, sure, anytime. Thank you so much.
participation, and I hope, I believe, I will invite you in another episode of this podcast and we'll discuss some other questions for the people who can learn a lot through this podcast and they will make their life easier as you are.
Thank you so much.
Much. Have a nice day. Have a lovely day. Take care. Goodbye.
Take care. Bye bye.